I am absolutely sure you will not be disappointed, because I've had the privilege of listening to Professor Luke Clements before on there. The format of the meeting will be Professor Luke Clements is going to talk to us and give us his evidence and his research. Then Sarah Westerby from Lead A will be talking to us about human rights, and if anybody's followed the floods on the public inquiry, everybody familiar with that case that's going on? Well, the wonderful Sarah Westerby is part of the team in that, on there. Then we're going to have the wonderful Mary Gibson, authoress, who's going to talk to us about her book and her personal experience with Herefordshire Children's Services. I think Donna Conway is also going to share her experience on there. I'll do a little bit just about collective and about aims and objectives. Then we're going to have a panel of questions and answers that you can ask anything. Please kindly don't talk about your personal cases. That's not the forum. But do start thinking about what sort of questions that you're going to ask in the question and answer on there. I'm actually going to give the opportunity to the professionals to hear the one question that I'm going to lead with, and I'm going to be asking them to give one piece of advice for any parent that is going through what we're going to be talking about today. So I'm going to ask the professionals will do the question and answers, as well as Mary and Donna, but just to give them a little heads up on that one on there. So without further ado, the wonderful
thank you.
Professor Luke Clements, who is cerebral. I'll be in trouble if I don't say, did I pronounce it right?
Well, it's very flattering. Yeah, thank you everybody for coming along today. It's a great pleasure. Yes, I am I have a research institute at the School of Law at Leeds. It's funded by a disabled children's charity called Cerebra. So that's why I am Cerebra Professor of Law and Social Justice at Leeds. I'm really grateful to Cerebra. They fund research that my colleague, Dr. Anna Aiello, at the back there, and I do, it's just a dream job, very depressing, but amazing to do. What happens is that Cerebra, a colleague from Cerebra is here, Derek at the back, and the helpline. If I explain, I ceased to be a solicitor last year. I was a solicitor for 40 years, doing all sorts of stuff. And for 20 of those years, I was a solicitor in Hereford, before I took refuge in academia. And acted for a broad range of people who live with disadvantage, I suppose. And what we do at Cerebra is we have a very large number of members, parents of disabled children, and a brilliant advice line of which Derek is one of the team. And we sift through the problems that parents bring up when they contact the advice line. And then we will do specific focus each year at Leeds on one of those very commonly occurring problems. And so they're about to say the facilities grants or direct payments, or we're going to do one on incontinence supplies this year. So there are a very broad range of issues, and often that requires strategic action. So instead of giving people advice individually, we try and change the law, change the guidance, and so on. A couple of years back, we were getting a lot of families saying that the process of being assessed by social services was deeply humiliating, was traumatizing, and many families would contact social services and children's services and say, and this is throughout England, there's nothing unique to Hereford about this at all. They would contact social services saying, I've got a child, and he's got demand avoidance, or some other impairment, and I'm not getting any sleep. We've got 2 other children. I can't really keep things together. I need some help. And what would happen is that they would then be visited, sometimes by the Archangel Gabriel, sometimes by, and very commonly the ones that we get, by social workers who often turned up with little or no notice, often at incredibly difficult times when there were other family members present or something like that, who would be cold, wouldn't be empathetic, would hand out 2 leaflets. One was about assessment, one was about safeguarding. Would say they need to see the child's bedroom immediately and look at the mattress. They would need to look in the cupboards. They would need to interview the child on their own, and things like that, which left the family utterly traumatized. They just asked for help. And they were being treated like criminals, like they were abusive. So we looked at this issue to see if it was a prevalent issue or not. And what we found is that every English authority that we looked at only had a one-size-fits-all assessment process. And that was predicated on child abuse and neglect. They only had one form. They couldn't provide another form. And that was, have you seen the bedroom? Have you seen child on its own? Have you done these things to the family? None of them had guidance on how you treat disabled people, parents or children who are not neurotypical. None of them had guidance on disability issues at all. They were all about child protection. And that came from the government. It's a thing called Working Together. The guidance took on this complexion in 2013, and it's been reinforced ever since. And social workers didn't have any choice about what they were doing, because there's a tick box saying, have you done these things? And that has to be approved by their senior manager when they go back. So that's the system in England. And, I think the vast majority of social workers came into the profession to do good, to provide welfare. And quickly they get absorbed into a culture that is truly damaging, or it creates safeguarding issues, it creates trauma, it creates abuse of families that are already suffering huge problems dealing with an unresponsive state in relation to education, social care, adaptations, and you name it. So we published this report, which talked about institutionalising parent care of blame. It became sort of institutionalised. And I haven't got the slightest doubt that that's the case. And we articulated in the language of the law and a lawyer that it was straightforward discrimination and it was a breach of human rights. The right to privacy, intimacy, respect for your home and your family. And I've not met a senior social worker, and I met lots, and most of them have all of them have said, yeah, we accept that. I've spoken with very senior people in the Department for Education, and she says, yeah, I completely accept. We've got to do something. And nothing's happened. And so we have a system that I think is an unintended consequence of the obsession with child protection, is traumatizing millions, probably, of families. Whilst we were doing this, we realized that there was a particularly pernicious form of parent blame. And it kept coming up and up and up and up. And Cerebra noticed it incredibly. And that was this thing used to be called Munchausen's syndrome by proxy. It's now largely relabeled as fabricating or inducing illness, where parents are accused of fabricating or inducing an illness. And so we decided to focus on that, which was the work we're working through at the moment. I hope to publish a report before summer. Going back, actually, the key findings of the general problem were that local authority systems assess families and children the same way as they treat families suspected child abuse, because they have just a one-size-fits-all. They don't have any guidance, specific guidance that talks about dealing with disabled children and their families differently. The root problem is this Department for Education guidance, and local authority guidance just follows that. And the result is very disproportionate interference with family lives and discrimination. We articulate that pretty clearly. So, a lot of the families were talking about having been accused of fabricating or induced illness, and being traumatized by that. So we decided to spend this year looking at that. We did an analysis of the websites, the policies of local authorities. We sent out a lot of freedom of information requests on this issue, and we did a survey of parents. And we got a large number, but for methodological reasons, it was reduced to a core of 384 responses in England. And so, so fabricated induced illness is I haven't got the slightest doubt that it exists. So I should make that very clear. I don't deny for a minute that there are cases where families, the Munchausen syndrome approximate, it does exist. And I don't want to be seen as saying it doesn't exist. The Royal College of Paediatricians have issued guidance, which they changed fairly recently, and it's now called perplexing presentations, or AKA fabricated induced illness. That guidance is highly contested, and particularly by the British Association of Social Workers, who have recently issued new guidance to social workers. And that's a truly excellent document, which says, for example, that because of course, if a medic says, we think you are fabricating this, it has to then go to social services, who are the safeguarding authority. And it's quite difficult for social workers to stand up. It's difficult to all of us to stand up to consultants, or what have you. But it is emphasising that it's social workers that have to express, to deal with that. And that they need, and this is something I'm really going to emphasise, they need to be aware that the currently used indicators for FII have a high incidence, that they're not any good. Basically, they're very difficult in identifying what FII is, and I'll come back to that. What I come on to explain that FII is, all the evidence shows it's very rare. It does exist, but it's very rare. It's a bit like finding a needle in a haystack, except you don't actually know what the needle looks like, because we don't have any agreed description of what it is. And of course, finding a needle in a haystack is okay if you've got a strong magnet, but we have no scientific ways of actually assessing what is, and if it really does exist in this case, FII. Social workers need to be aware that the behaviour of autistic and neurodivergent parents can be easily mistaken for the characteristics that the Royal College describe parents. So what they're saying is that the sort of symptoms that the Royal College are saying would indicate that a parent is not perhaps behaving properly are classic system presentational issues that you would get from neurodivergent parents. And that in very many cases, what is thought to be FII turns out to be a medical misdiagnosis. The child really isn't. And it's just that the doctors don't want to accept. I'm going to come back to that. So, FII is thought to exist about 0.5 to 2.8 in 100,000 children. So it's not 0.4%. It's 0.004%, effectively. illnesses of children. So it exists, but it's extremely rare. And the Royal College, to its credit, says that. It's an extremely rare condition. So in Hereford, you'd expect less than one case a year. So the question is, what resources should authorities put into identifying fabricated and induced illness if the prevalence is less than one a year?
Can I just say, you mean there should be one case in Herefordshire?
Every year. You'd expect it on those statistics.
Yeah, as opposed to
Herefordshire, sorry, Herefordshire.
And one actual confirmed case, or one accusational case?
No, you'd expect there to be one child in less than one child. It's actually significantly less than one, maybe one every 2 years, who is actually having their illness fabricated or induced by their parent. So it's that level of rareness. I'm not going to quote him here, but Professor Billson's done a lot of work to show, even though that is serious, he's not identified any case where a child has died. But, I'm not undermining that this is a really serious problem. But there are many illnesses that we might encounter, one person in Hereford might encounter. What sort of level of resources would a public body put in to deal with that? And as I say, these things are not known to be fatal. So we asked some freedom of information questions about the NHS, and we've asked them of local authorities as well. But fabricated and induced illness, I'll explain, the prevalence of these come up, they are raised by a number of actors, and the NHS, of course, is one of them, but only one of them. So, we asked the local NHS body how much training they had given their staff, how many staff they had trained on FII in the last year from 8th of October 21 to 10th of November 22. How many staff?
0.
No, it's 353. 353 people have been trained using the Royal College guidance about the dangers of FII. The dangers that are going to be very, very unusual indeed in Herefordshire.
Is that for parents or is that for actual nurses? Because obviously
these are sort of frontline professionals.
No, but why are they training them so much?
Because they're coming across families, I suppose.
Because, Julie families, we often hear about nurses actually who have this issue.
Yeah, I mean, there would be, I imagine, nurses, all they're saying is frontline professionals. 350 frontline professionals and 3 senior managers.
Okay, it's just locally, we've just had that nurse that's was killing babies, I think.
Yeah, but that's not FII, that's just straightforward news.
Trial's still ongoing.
It's alleged.
Well,
Yeah, but it could be true, but it isn't FII. FII is not that. It's this is somebody that's...
Yeah, so they're specifically...
This isn't Victoria Climbier stuff. This is where...
And just to clarify, you're talking about a trust within Herefordshire itself.
This is now the Integrated Care Board, but it wasn't last year.
Yeah, so it would be.
I'm not going to.
So for Herefordshire and Worcestershire, it's 353
frontline
professionals have been trained in
8 different sessions. Yeah, 8 different sessions. This is just the NHS. We've got social services, we've got education, we've got the police.
Mm.
We've got a huge number of people being trained about the dangers of this condition, which we can't really identify very strongly. Being sensitized to it, effectively.
Who trains them if they don't really know?
That's a whole different story, and that may come out in the media soon.
Okay.
There is a training. There is our group of people training, who is another story. Sorry.
Are we speaking nationally or locally? We're talking about Herefordshire with that number, we're talking locally, or we're talking nationally.
Locally.
So it's in Herefordshire.
Yeah. Well, I'm not sure if it's Herefordshire or if it's wider than that. because this was the integrated care board, but the freedom of information request was up for Herefordshire, and that was the figure that we were given. And the integrated care board didn't exist last year. Well, they did exist, but only in June last year. So this is a local group of frontline professionals, nurses, and people like this. I understand it's pretty well mandatory for some groups who are all being told there's this incredibly dangerous condition and you've got to spot it. This is a condition that they would, all of them, is very, very rare. If you look at this body's guidance, which is on the West Midlands stuff, just look at it. It's just extraordinary. It's pages and pages and pages. These are organisations that we've asked for the guidance on disability awareness, and there's no guidance. There are thousands of disabled children. There's no guidance on them. But there are pages, pages, pages. You scroll down that, go to that link. And this is not picking on the Herefordshire. This is national. This is every authority that we've looked at has this. This is not atypical. And do they refer to the fact that does this guidance here, which is to say, scroll down, does it say this is a very rare condition? No. Does it say that what is the impact of false accusations? And that's the bit that really I want to sort of finish on in a way. What we call false positives, and most of us know about false positives from COVID, where you get a result that says you've got it, but you haven't got it. Because any testing thing will have, maybe very good at identifying it, but it will also identify other people as possibly got it, but they haven't. And of course, as I say, we're just looking at training and policies here at the NHS, but that is replicated in local authorities and schools. And there's nothing here that's unusual in Hereford. I've picked on that, but we've done it throughout the country, throughout England. So this is a national issue. And what I'm going to say, at this stage, we have no data to say that Hereford is untypical. It's got more. We don't have any of that data. There may be data, but we don't. So Goll and Scott, in their paper, and I've already mentioned that paper, they say that if you've got a test and it's 100% accurate in identifying a condition, let's say COVID, or let's say fabricated or induced illness, but it's only 90% accurate in excluding people that are wrong. So it will say that 10% have got COVID, or 10% have fabricated induced illness. So in this case, it would get that one in Herefordshire, or in the UK, we'll get that 150, what we would expect in the UK, it's about 130. How many people, if you get it 10% wrong, would it have? And they say if you've got it, if you only have a very accurate test and you get that one, or in the UK it would be about 130. If it's got but if it actually misdiagnoses 10%, just 10%, in England that would be 1,339,000 families wrongly accused. And if you want to look at false positives, look at Professor Whitty. You just Google Professor Whitty, because this was the obsession with COVID, that if you were doing COVID tests, you had to not only get the people with COVID, but you didn't want to get people who didn't have COVID and think they had, because that would run into tens of millions, well, it would run into millions and millions, it would be tens of millions, who would then be off work for 15 days, or 10 days, So these tests have got to be not only incredibly accurate in identifying people who have got the condition, but incredibly accurate in identifying people who don't have the condition and excluding them. And if you have a test that is only 10% good and 90% good for that, it ends up with this staggeringly large figure. And that's over 1.33 million children, families being accused.
I guess what happens to those families in those situations is the child is removed.
Well,
The protection on the majority of cases because they've got to be seen to act, isn't it?
yeah, well, this is what I really want to finish on, because, and I probably overstayed my time, but social workers need to be aware of the lack of evidence of currently used indicators. What the social services new guidance on FII is saying is you've got to be aware that this really isn't a good indicator. So it's not 90% accurate. It's not 99% accurate. It's probably 10% accurate. So you're going to have a huge number of false positives. And we all know that with these things. And the reason about these lateral flow tests, they were in a way delayed them because they were so keen that you didn't tell people they'd got COVID when they hadn't got it. That's almost more important than telling them that they had got it and stayed home. So, what are our findings? Our findings are that 50% of the people accused of fabricating a dual illness, over 50%, are disabled parents. And a very high percentage of those have neurotypical conditions. Exactly what Baswa surmised, sort of theorized would be a problem, because people who are not neurotypical meet all the criteria that the Royal College set. Now that is discrimination. You have a straightforward policy that's discriminating against disabled people. Only 10% of parents are disabled. And yet 50% of the people being identified as disabled, and predominantly those came into autism, ASD, ADHD, and so on. 50% of the allegations that families had, just under, arose after they had complained about a school or a professional or social worker. A lot of people say to us, this is vindictive, this was to shut us up, we're being very assertive, we're questioning this professional's judgment.
There's plenty of other organisations that support that, not just
Yeah, well, I mean, this is something, anecdotally we hear a lot, but we've actually got hard data to say that's happening. And, there may be many explanations for that, but on its face, it's worrying. And we didn't find any statistical clusters. So the range of responses are pretty, there's nothing statistically significant with Lancashire or Hereford or Brighton. So that survey just covered a lot. So we haven't seen those clusters, but we suspect there are clusters. But our research hasn't suggested that Hereford's got a particularly unique problem or Northampton or anything like that. Because of the media coverage about Hereford, it was drawn to my attention, and I was sort of quite interested because, coincidentally, I live in Hereford. But I had no idea of that. But we have not found anything. We have no data to suggest there are clusters. And in terms of, one of the questions we asked was, who is it that started the ball rolling on your allegation? And the biggest group was saying, we're not sure. So the biggest group was saying, we don't know, actually, we couldn't work that out, or when we were analysing the data. But what was interesting is the identified groups were in that order. The NHS was 1, education was 2, and children's services were 3. And that's something I didn't expect.
And you see, public questions that we put forward to Herefordshire Council, they're saying that no FII will be alleged to have found unless it's come from an NHS. The fact that you've got education up there, that that's quite interesting. As this is again talking about Hereford, that the public questions
No, well, I mean,
answered.
yeah, I mean, the issue is that if education, and a lot of the education cases were after parents had made complaints, significant thing. But if education or health raise an issue, it has to go to children's services because they are the safeguarding authority. And sometimes it's very unclear how it originates with social services, but children's services, but there's no particular evidence that where it came from.
So it is focused on to that, because if they're saying that they're always coming in saying something on their child, obviously if there's funding in that need for that child, they will push that forward because it benefits the school. If it doesn't, the funding, we're not a primary school. They're not interested in it because they don't get funding for it. So it becomes a pain when the parents know there is an issue.
Yeah.
They're saying, well, it's not an issue. And then they escalate it, say the parents come in, and they're focusing the social workers directly on FII.
Yeah, and that's why the Basel guidance is so important. It's saying to social workers, you've just got to pause and just look at data. But it seems to me that, that in a way, social services is a long stop, and I think in much of England they're failing to do that. But the point is this, what I'm really interested in, what I'm going to close on, is impact. What many parents are saying, and I've circulated to all of you, I think most of you, but Anna's got this list if you haven't seen it. It is the easiest thing in the world for a professional to say, well, I don't believe you, I think you're fabricating it. It can just be said. And it could be said because you're seriously irritated with this person that keeps questioning and being very demanding. And you can just say it. And I think, I have no doubt that that's very often said.
Yeah, but if you speak up against the social services or try and point anything out to them, you get told that you're being unreasonable.
Yes, yeah. There's this sort of vicious cycle. It's evidence that you're unreasonable.
But it's bigger than that. I mean, even judges will turn around to you and say that you're too intelligent a parent. You
Hang
don't
on.
have to have
Do what I said in court.
Yeah.
I said in court.
I've written a book on this, so I'll sell you it all later. But let's just focus on this point, because I think this is the legal point. It's very easy just to say, I think, you are fabricating this, to shut somebody up, perhaps, or something, or to be vindictive, or just to do it casually because you think it's a possibility and you might as well hear it. It's very easy to get a false CPR test, a false lateral flow test. What are the consequences of getting a false lateral flow test in COVID? Well, it's a bit awkward. You've got to stay at home for 5 days. You have time off. You might lose some money. But then you're fine, so you go on. And there's no consequences. What are the consequences of being told that we believe you're fabricating this illness? Well, the consequences can be prison, and, people have gone to prison over this. People have committed suicide over this. People in our survey, we asked, say they never, ever get over that. Their life is utterly broken. And we've got this list which we've shared with you, we had 41 pages of comments on what it feels like to be falsely accused. And it was traumatizing for me to read it. I've summarized it as 7 pages. And reading that, and I've sort of shared it with you, is something that is utterly harrowing. What somebody is doing when they do that, it seems to me, is straightforward negligence, or it's reckless, or it's deliberate. All of those things are deliberately inducing unbelievable psychiatric harm in families. And that has to be articulated in the language of the law of professional negligence or just personal injury. Because those sort of harms, once you start to sort of realize that people, just read some of those things, and the word suicide, loss, total loss of confidence, never go to see a doctor again, never approach social services again.
Why would you?
And that's why we're experiencing it.
Yeah.
We're experiencing it. We're crushed to a pulp.
Yeah. And
We're crushed to a pulp. We're on the floor.
until
That's
the legal system
criminal.
brings this to account, to say this guidance is causing this epidemic, this has got to stop. And anybody that does that, it isn't a casual thing because it will cost you your, Roy Meadows did it once, in a famous case involving a solicitor who subsequently killed himself.
And you get close.
And he got vindicated eventually. Well, he didn't get vindicated, but he didn't really suffer. He suffered short-term consequences. There must be seriously persuasive consequences for professionals that do that. And that, it seems to me, is where we need to have brilliant human rights lawyers. And that brings me on to just welcome Sarah. It's really lovely because I first met Sarah 20 years ago when I was a real solicitor in Strasbourg at the Royal Court of the European Court of Human Rights. And she is the most brilliant human rights lawyer working for a really unbelievably brilliant firm. So it's great for you to come.
Well, thank you, Luke, for a fascinating talk, but also troubling in in the information that you've shared. But thank you. Thank you for inviting me here today. I'm here really to listen, so I won't take up too much of your time. I'm Sarah Westerby. I am from Herefordshire and I live in Herefordshire. I work for Leeds in the Human Rights Department, and my colleague Emma Jones is here as well. She works in the same department as me. I work locally, I work nationally, and the sorts of areas of law I work on include Human Rights Act breaches, negligence claims, court of protection, which I'm sure some of you unfortunately will be familiar with that area, and public inquiry work. As Melissa mentioned, Emma and I are just coming to the end of over 4 years on the infected blood inquiry, which is coming to an end this year. So we've been working on that together for a long time. The issue in Herefordshire first came to my attention reading the judgment, the Keane judgment, which perhaps some of you will be familiar with, which has been around for a number of years now. So as a lawyer, I read those judgments and the criticism in them, and then I've continued to follow what's been going on with the Panorama documentary and the sad Ofsted report from last summer, and also listening, unfortunately remotely, but to the extraordinary general meeting, which was at the end of September last year. I've been contacted by a number of individuals and families looking to understand if there are avenues of legal redress for what happened to them, and I'm investigating that at the moment. What I'm also trying to do at the same time is understand whether there are common themes which show that perhaps the experiences of some might be the experiences of others as well. And there's sort of 4 or 5 key themes that I'm looking at today of relevance is unfounded allegations of FII, instances where children have been removed unfairly in their circumstances, examples of where safeguarding procedures haven't been followed when they should have been, where complaints policies haven't been followed to the letter when people have tried to raise their concerns, and other issues perhaps that I'm not yet aware of but I'm here today to listen primarily, so I won't take up more of your time, because I think that's really the process here, is to listen to what's gone on. So those are the things that I'm looking at the moment, and I'm trying to gain an understanding of who is affected and for how long. From the reading that I've done and following things, it's clear that things have come to light in the last few years, but is it more long-standing than that? And that's something that I'm going to be thinking about. And the sorts of legal redress in these sorts of situations that I've touched upon include Human Rights Act breaches, specifically Article 8, the right to private and family life, and have that right been unfairly interfered with in the sorts of situations that I've outlined. Negligence is a duty owed, yes. Has that duty been breached? And discrimination. I think some of the issues that you've discussed are really concerning. So what I'd like to do is think about those things, listen to what we're going to hear, listen to what we've already heard today, and continue that process. Thinking about whether the issues stated here warrant calls for a public inquiry into what's happened. The threshold for that is there sufficient public concern about an issue? I know we're awaiting the report of Eleanor Brazil at the moment, and I'll read that with interest and see what her recommendations are. But yes, that's it from me. I'm here to listen. I'll be here at the end. So please, if you have any questions, please can find me.
Okay. Can I just ask a quick question about judicial review in terms of public inquiries?
Can I get you to do that again?
Yeah.
Question not just to get through, but we can definitely, because I'm interested in that. Well, I'm sure a lot of staff that's okay. And then you write it down and then we'll just go back to you. Oh, lovely. We're going to hear from Mary now, who is going to tell us a story which carries on from what Sarah's spoken about. So we've got the
Sarah,
Then you've got a book.
I've got a book. You've got a book. That's tangible. We can take that away.
Thank you. I'll just say, I met Mary through the Marches Family Network, who are here today. The amazing Kerry and Ray, who is the manager, and our common interest and what John and I all put together, because we have certainly have sacred children in our family, and the only people that we actually had at that time was the Marches Family Network, which is an amazing organisation. And it's all self-funded and independent on there. And we managed to be able to support each other then, because we were very isolated in our situation. So Mary will talk about her story.
I will say it is still very, very difficult for me to talk about what happened. On the 5th of March this year, it will be 10 years. 5th of March 2013, my daughter is here with me today, by the way, Victoria. And so that day, the 5th of March 2013, is the day when social services and the police turned up at my house. My daughter had support workers through the Aiming High funding, and the support worker was there. I was out because that was my time to get out and have coffee myself and just have time to myself. So she rang me up and said, look, the police are here. And I was like, well, what's happened? Has something happened to John, my son? You know, what is it? So I got home and there was all these cars on my driveway. There was people there with boxes, scowling at me, really turning their noses up at me. And I walked into the house and Victoria was sat at the kitchen table in tears with a social worker there. And then in my sitting room were police officers. And the police officers took me aside and said to me that we're arresting you on a charge of child cruelty. Now, we had no idea that anybody had any concerns at all. Victoria, yes, I co-medicated her, and she was going to do it absolutely fine. The council knew about that, they were very happy with it. There had been issues all the way through school, and everybody seemed very happy. And it was just a complete shock. The police took me away and interviewed me. They took me to Lancaster and interviewed me there. I was able to have a phone call to my sister, and I told her about it, and she was just in complete shock as well. So what's all this about? Everybody knows how well Nicky is. She's doing absolutely brilliantly. She's never been so well in her life. And the police interviewed the children. This meant they had to take my son John out of school. Think of the shock that was for him. And when they said they were going to take Victoria and interview her, I said, well, can she take her little dog with her? Because that will give her a little bit of confidence, and she'll be very anxious, and that's what they did allow that. And I did see the interviews that my children did, the police interviews, the AB interviews, and I just sat with tears all the way through them, but also feeling incredibly proud of my children. The first thing that my son said was, "This is Dad, isn't it?" Now, I am divorced from my ex-husband. He has autism himself. Now, this is something, whilst we talk about local authorities getting involved with parents who have a disability or who are neurodivergent, what a lot of people don't seem to understand sometimes, that somebody with very high functioning autism with Asperger's, depending on how they're affected, can end up with a complete obsession. And this is what my ex-husband did. I divorced him. He hated that. And during the divorce, he tried to say I had Munchausen's. Because both my children have had a lot of very significant health issues. My son himself had been diagnosed with autism. And it was during that diagnosis that the paediatrician said to me, "I've been more worried about your husband than about your son." And so he had this complete obsession. And ever since I left him, he spent his time writing letters. Letter after letter to the paediatricians, to anybody he could think of, to have, to say that, oh, Victoria doesn't need this, Victoria doesn't need that, I'm making it up. And when I sort of look back about what had happened, about when social services did come in, I got a bit of a trail, and there was a letter from the GP which said to my ex-husband, "We've done all we can," not that he'd ever seen Victoria recently, "I suggest you ring the child protection nurse." So the next thing is the strategy meeting. So we don't know whether he rang the child protection nurse, because it was the child protection nurse who actually put the referral in. Presumably he did, and no doubt he put the field body. And at the strategy meeting, because I do have minutes, there was only one person that knew him. And that was the elective home education officer, who had seen Victoria over a number of years, and she had only written glowing reports about Victoria and herself, about her progress with her education. And even my solicitor said this, it's not obvious why they came in, because in the strategy meeting minutes it doesn't, it does say, well, she's not in any immediate harm. At this point in time, I will say that I had Victoria with her health issues, and I don't know whether are you happy for me to say it, Vicky, or
Yeah,
because
that's
it's very
fine.
personal? Thank you, yeah. So the main issue was that she wasn't going into puberty. And so the NHS locally at Hereford Hospital done tests. They claimed, oh, everything's fine. I knew it wasn't. Here was my daughter wanting to be a teenager, and she wasn't becoming a teenager. You know, she wanted to be like her friends. She wanted to look like her friends. She still had the body of a 7-year-old. And so there was investigations done at Birmingham Children's Hospital. They were devastating. It was very clear that her body literally was a 7 or 8 year old. Zero pubertal development at all. What did they do? And they suggested an MRI. Well, I then took her to a private professor in London, very, very prestigious professors working privately, and endocrinology. And he was convinced there was something wrong, and he did some tests, and yes, he diagnosed she had no estrogen, literally. And other thing, no FSH, no LH. So he recommended an MRI scan and referred her back to the NHS. Well, they weren't going to do one for 12 weeks. So I wasn't happy with that. I needed to know, because he thought she might have a tumour on her pituitary. And anyway, she didn't. But it did say that the anterior lobe of her pituitary was very small, which is probably what was causing it. With the private doctors, whilst it's suggested that I did all this myself, I did have private doctors who were advising me, and whilst they wouldn't and couldn't prescribe, they recommended to me treatments that I could source for her, which I did to start with. And then she made absolutely amazing progress, totally amazing progress. And then she was referred to Dr. Hertog in Brussels. And you see, one of the things with fabricated induced illness is they say that the parent goes round different doctors. In fact, I was accused of doctor shopping, and also that they don't tell doctors the full story. I gave Dr. Hertog everything and let him make his own decision. And in fact, he would only make his own decision anyway because he's such a professional, and he always has other doctors there to back him up. So it wasn't me saying, my daughter has X, Y, Z. It was him saying, give me all the test results, I'll do my own. He did his own test results, his own observations, far, far more comprehensive than the NHS does. And he continued with hormonal medication, and Vicky was just in another world. I mean, she was, I can't describe it, it's very difficult to describe, but everybody around us saw it, even her father, although he denied it. Everybody saw this child develop, blossom, and develop her confidence, develop her speech, develop her education, she was just flying. And then bang, the door was pulled from under her feet by Hereford Social Services and the police. And when I got the paperwork, because they already put it into court, so at the end of the week was the first court case. And when I got the paperwork, it was shocking, because it was all talking about her never ever coming home again. And it's like, what? This can't be right. There was no indication, oh yes, well, you know, we'll look into all of this and we'll check everything. Nothing, it just she'll never ever come home again. And the police said they were going to go and see Dr. Hertog. They never did, presumably because they knew he'd back his own treatment. Don't know why. And it is typical of what Luke was saying, is that nobody looked at things in detail. Nobody sat down and thought, hang on a minute, is this actually true? And if they'd have looked at the detail, they'd have seen actually there was an issue here, and no, I wasn't fabricating it. And of course, see, on the day that the police came to my house, after they'd arrested their search, and they took all of the records of my children. They had about 3 big files of records, Vicky's had a statement ever since the start of school. So obviously there's a big pile of paperwork associated with that. And they never released that information until after the criminal trial, until months after the criminal trial. And so when I also got this information from the local authority, it didn't include, particularly the most important thing was at 3 years old she was diagnosed with severe verbal dyspraxia and was in a preschool language because she couldn't speak at all. That wasn't there. And then it was all, and even some of her records have been changed. Like when she was younger, she'd taken an overdose of paracetamol. 50 mil. We reckoned it was no more than 50 mil at the hospital because they were asking me. And suddenly that had been changed to 500 on her nose. Well, I don't think she'd be here if she had actually had that much. But it was all the paperwork was designed to show me in the worst possible light. And I was very concerned because I thought, well, I haven't got the paperwork. I can't prove, I haven't got these reports I haven't got the results from Birmingham, I haven't got this, that and the other. Because the police have got it. And the other thing I would say is that the day I came home from the police interviews, I think I got out about 11 o'clock at night. Once I got home, he was actually shocked. Very bang, bang. Really, really, really painful. And they lasted days. And it was, the only relief I could get was to try and get to sleep. And then as soon as I woke up in the morning, they'd be back. Eventually they did go. So we go through the family court. I had previously used a solicitor to, whilst we were redoing Vicky's statement with Herefordshire, it needed to be reviewed, and of course, as a parent, you do generally have to get private assessments done, and also sometimes get a solicitor involved to help you get the result that's needed for that child. As it happened, that solicitor had got all the records up to a certain date. So now I could prove that, certainly up to that date, that Vicky did have things that needed a lot of intervention. And she needed intensive speech therapy for years. And anyway, so we went through the family court, and there was going to be a fact-finding hearing. My solicitor refused, because I had dreadful legal help, refused to bring in the doctor from Brussels. And she also said at the time, there are 5 other cases in Herefordshire at the moment, going through the courts. 5, wasn't it? And I knew the fact that this wouldn't, the fact-finding hearing wouldn't be in my favour, because I didn't have all the results, and I didn't have the doctor from Belgium. And on the first day, my solicitor put me under intense pressure. My solicitor and my barrister, and I think I had a QC as well, they put me under intense pressure for a whole day to get me to sign a piece of paper that said I'd harmed my daughter by giving her these medications. And I think I've been there from 9 o'clock in the morning, it was now 5 o'clock at night, and I did finally cave in. But it was very much under duress. That meant that it went straight to a psychologist. So I chose a psychologist from the list, and that assessment went ahead. This lady, she went to see my ex-husband first. She went to see my son, and she also went to see John. And then she came to my house, and I'll never forget that day when she came into my kitchen, sat down at the table. First thing she said was, "Your children adore you." And I just didn't know what to say, really. And after everything, all the way through, both children were saying, it's all wrong, this is not right. I have letters from people from the community all saying we've seen Victoria improve, all ignored. Letters from professionals who were involved with Victoria, they all said the same thing, well that was ignored. So the end result of this assessment from the psychologist was that I did not meet the criteria for fabricated and induced illness, and that Victoria was being harmed by not having unsupervised contact with me. And then she could come home as soon as she possibly could, and particularly she must do what she usually does at Christmas. She must have her usual family Christmas. So what does the local authority do?
That's a second opinion.
No.
Oh.
No. First, we don't agree. How can they say that? This is a court-appointed official. How can they just turn around and say we don't agree with your assessment? But they did. And at this point, I asked my solicitor what we're going to do. Oh, we're going to try and get Vicky home. I thought, no, you're going. You haven't defended me appropriately up to now, so I sacked her. I sacked the committee, I sacked the barrister, and I sacked the solicitor, and represented myself for a short while in the family court. And the council also pushed it into the High Court, so I represented myself in the High Court for a while. And so I knew that the local authority were going down the route of, oh, she's still on police bail. The police haven't decided whether to charge her or not. So of course the judges couldn't send Vicky home. I mean, they did apologise to Vicky, the judges did, which is something. Oh, and that's another thing I must say, that the judges in the High Court were very, very offhand with the local authority. And basically told them, what are you doing this for? If anything, she's not going to have any more children because of her age. And then they said, well, has Victoria been told that she could come to court? Well, of course, she hadn't been told that she could come to court. She hadn't even been given an advocate by the local authority. It was me who thought of the advocate. And her father wouldn't let her go to court. In the end, a friend went and picked her up and took her to court, and then after that, I think we did get there quite regularly. But it was just unbelievable. So anyway, I knew what was going to happen, that I would get charged. I just knew what was going to happen after that. But, that's what was happening. They were going to make sure that I got charged. We had that Christmas, it was the most awful Christmas, because Victoria wasn't with her family, she was just at the farm on her own. Very upsetting for her because of course John was with me. And, by this time the local authority had no interest in John at all. So they have two children. One has total can see me whenever he wants, and there's no issues at all with anything. And Victoria, who couldn't speak to me at all. Who couldn't see me. Contact was dreadful. Hardly happened. So I think it was the 11th of January 2014. I had to go back for my bail. And then I was charged. 3 counts of poisoning with intent. And Victoria was already suffering at Christmas. From that point on, she couldn't cope at all. And her mental health just plummeted. And then, of course, we were also coming up to the anniversary of the 5th of March. Victoria couldn't understand why she couldn't speak to me. And so she contacted me, she ran away, she contacted me, she was ringing me up, contacting me, and all sorts of things were happening. All of that broke the bail conditions. Monday, Thursday, police turned up at my house, arrest me again. Of course, you can't go to court on Good Friday, so at least the Saturday I'm in court, and I get sent to Eastwood Park prison. on the van. Police won't let me out. 6 months later, the trial starts, and what I will say is the day, also that weekend that I was charged, Victoria was first sectioned with a diagnosis eventually of psychosis. And obviously given high doses of antipsychotics. She was sent up to Berry Hospital, 160 miles away. Nobody could go to see her, only her father. And as I'm from Lancashire up there anyway, there was plenty of friends who would have wanted to go and see her. But of course they couldn't. And so after a 2.5 week trial, Dr. Hertel gave evidence by a video link halfway through the prosecution evidence, so they extended their time. At the end of their evidence, my barrister put in there was no case to answer. And that was the end result. The judge agreed, no case to answer. So there I am. You know, I'm not to have fabricated induced illness. And there was no case to answer in the criminal court, been in prison 6 months, no criminal record whatsoever. You'd think, let's send Victoria home. Because she wants to come home. Not a chance. What do they do? Send her to a care home. And that further traumatises her. Because one of the things was, she'd had a private diagnosis of autism when she was younger. The NHS had dismissed that. The local authority was saying, I treat her as though she's autistic when she isn't. And it was, she is autistic. She does now have a diagnosis of autism, an NHS diagnosis, no less. And so you can imagine what this does to a neurodivergent young lady in their teenage years, at a time when their brain is really developing, and they just destroyed it. So at the care home, she was 16 and a half by then. She couldn't have her phone. She couldn't have her computer. She couldn't have, just go to the phone and ring somebody up. And she couldn't get on the internet without the review. 16 and a half. What a way to treat a teenager. I just cannot believe it. You just don't do that. Anyway, so I put in a case to discharge the care order. That means that Victoria has to have a capacity assessment. Yeah, she's got capacity and all the rest of it. So she eventually comes home the day before her 70th birthday. Okay, well
done, Mary.
Her order is discharged in November. But that really was only the start. All hope that Victoria would be well and happy. But the following year, coming up to the anniversary, we had no idea of the depth of the PTSD. And the reaction that she had was just horrendous. Totally convinced she was going to come in again. I had to be out of the house. We had to leave the house before 9:30 because that was the time they came for. And then she descends into psychosis again. So that's another section, another 2 sections. She doesn't come out till she's 18 by then. And of course I'm looking after her at home. That's the other thing. I don't know if anybody's ever looked after somebody with psychosis.
I have, yeah.
But it's really hard, isn't it? Really, really hard. And it's a 24-hour.
Yeah. Especially when they haven't got any hospital beds.
Yes.
Well, they attack us for
yes,
not having the beds, yeah.
Yeah. Well, they did have a bed, but of course she was just a few weeks off being 18. So we had to wait till she turned 18 before she could be sectioned. But I had no help at home. Nobody helped her. Anyway, so that was that. And she recovered from that. Because she was so frightened of the house, we sold it, moved up to North Shropshire. She had another reaction in 2018 with psychosis and second again. And I will point out that up in Shropshire, we've been treated amazingly. Absolutely.
That's really good.
It is.
It is really good.
I was just asking,
yes, just buy your book.
Yes.
There's copies, buy the book.
Yeah, last year she had another reaction to the anniversary. And then of course with everything that happened with a high court case. That's when I contacted Cass Knowles and the team, and Cass conceded that this should never have happened. She couldn't believe it, and that basically they had harmed Victoria. And Darryl has now paid for trauma treatment for Vicky, which she wouldn't be here now without that treatment.
Well done. We're just going to have another mum that's going to come up and talk. So please just remember, it's quite actually a difficult process to stand up here and share. These are very painful truths that everybody is sharing. This is Donna. It's completely different from Mary's.
Yeah, very different. So my complaint is pretty historic. It goes back to as far as 2009. My son had quite a few difficulties in his young years, and he was diagnosed by a community paediatrician with a diagnosis behind closed doors. And obviously, I objected to that diagnosis as he'd not been seen by this particular person and challenged why psychosabilities were used to diagnose a child. This led to my first complaint, which was the most hideous process, which was then the primary care trust. It was so appalling that the complaints manager, the advocate I had at the time for my case, actually took the unusual steps of getting her chair and to write a letter to Herefordshire and object to the appalling way in which I was treated during the meeting and the way that the meeting was conducted. The process was just appalling, and unfortunately in 2011 I just couldn't continue with battling so many of them. And we had a lot of ill health within the family. And then Mary talks about the aiming high. But funny enough was that how mine come to life. In 2014, my son had access to aiming high funding. And to renew that funding with the group that we were in, we needed a visit by a social worker. And my son had been really, really poorly, and I just wasn't getting anywhere with any of the services. And when the social worker comes to my house, my son was actually in bed, really ill. He said, could he go up and see him? And I said, right, sure. So he goes up and he came down and he was very concerned about my son. He appeared to be a very poorly young man. And he was going to label him a child in need, which was all obviously new to me. It sounded fantastic with all the things he said he was going to be doing. And I said, I can assure you when you get back to your offices, you'll have every door shut in your face the same as I have, because I challenged a very professional person. Anyway, he then stopped answering my emails. Had a visit to the house, I presume unofficially, to tell me that, yes, that probably was what the reception he had received, and unfortunately, he then proceeded to tell me that the FII allegation was not helping. I hadn't a clue what FII meant. That then launched into me making another complaint, and the most useful thing I think I did at that time was I done subject access requests for every single agency, NHS, Herefordshire Council, nursing, everybody. I then took those notes and came home and I laid them out, and for the next year or so I became my own solicitor as such, and I compared those notes. And it was then I discovered that the professional that had made the allegation said that not just my son, but both my children were at risk from harm. And when you read that terminology, when you have a very sick child who you can't seem to get any help for, is gut-wrenching. Anyway, I proceeded to take stage 1 complaint. That stage 1 complaint was then processed to stage 2 because of the appalling way in which Herefordshire Council had dealt with this first complaint. I had an independent investigator come in, and I was very cagey because he told me his background, that he was a social worker, and I thought, oh, this is just going to be awful. So, he told me I'll leave no stone unturned, and to his credit, he pulled Herefordshire Council apart, and they were scored across the board inadequately low for the first stage 2 complaint. Everything came to light. I'd actually been accused 3 times of FII, and this professional was hell bent on, I think, making this allegation stick. But what was most upsetting was the lack of evidence, and this was based on her personal opinion. She'd met my son once, and from that meeting, she actually said that he was a very poorly young man. She was very concerned for the first meeting, but she was supposed to have produced a document as part of the child and leave meeting, and after 5.5 months of waiting, I actually made a complaint about her. Well, this is where the notes come in. So when I done the subject access request, in the notes I discovered that when her and I finished our telephone conversation, she'd actually picked up the phone to the complaints manager. And between the two of them, they decided to report me to FII for the first time. And obviously this is all going on in the background. I'm totally unaware I'm going to all these appointments not knowing that I'm being accused of FII in the background. Well, the stage 2, unfortunately, despite what was uncovered, I had hoped the hell would be over. But unfortunately, Herefordshire Council did not act on the stage 2 recommendations in a timely manner. The apologies were not forthcoming. So I decided, after having meetings with the Directorate of Children's Services, the Assistant Director and the Council of Children's Wellbeing on 2 occasions, which carried in the marches attended with me and was my advocate at the time, I then decided to take it to stage 3. As much as I didn't have any energy to do this, because everything had been upheld in my favour, I then took them to a tribunal. Once again, everything was upheld in my favour. There were no safeguarding concerns, especially meetings were held at full support of school. So all the allegations were based on personal opinion, not fact-based evidence. She did not go away and find out the true facts. She did not do what she was told to do by the safeguarding team at the time. But what was so concerning was when I done the subject access request was to see in there that an embargo, and the word embargo are actually there in black and white, been put on my son's care due to my complaint, which was just shocking. And then questions need to be asked about mother's claims to have lost family members to cancer. I do not expect to attend meetings to take my father's and my cousin's death certificates with me to prove I had died. It was the most horrific thing that happened in my life. But to then be questioned about it when they could have so easily gone away and checked this information. The stuff that was written about me was just shocking beyond belief. So we had the stage 3. By this time I'm absolutely exhausted, but I had hoped it would put things to bed and that would be the end of it. I just had a sneaky suspicion as my son got more ill, the help just wasn't forthcoming. I done another subject access request and sure enough, Herefordshire Council had documented, despite all what's been uncovered, that mother formerly accused of FII, however, made massive complaints. Now, I'd asked that stage 3 outcome and the stage 2 and the apology letters were put at the top of my son's file to avoid any new members of staff coming along and forming a dangerous opinion based on tickle-tackle from professionals. However, that didn't happen. So that was most disappointing. I had the social worker visit my house and tell me I needed to let go of the FII. I needed to move on because it wasn't doing me any good. So it was most disturbing to read that this person that had given me such great advice had decided to go away and update the case notes on a regular basis. Mother formally accused of FII, however, not enough firm evidence. There was no evidence ever. It was just personal opinion. Now the problem is, for me, Luke very much talks about the impact and what that does. The third part is, despite the years it's taken me, please bear in mind, I forgot to mention that in 2018, because my son continued to be very unwell and he wasn't getting his support, I decided I'm not getting anywhere in this county. So my flexible friends come out and I paid to take my son to a top rheumatologist. And the reason I picked this particular gentleman is because he also worked at Oxford Hospital, so he was very reputable. I thought, we're going to see him in desperation. My son was sadly diagnosed. Was diagnosed with 2 very rare conditions. He was diagnosed with Marfan syndrome, which is a connective tissue disorder. Unfortunately, he was also diagnosed with a condition called erythromelalgia, which has been caused by his connective tissue disorder. Now, that diagnosis came about in 2018. Since all this has gone on, my son has received, I can't even say any support, apart from support from me. At this moment in time, my son is now 21, and he took 4 years to do his 2 A-levels at the college. And that was a case of me driving him in every day so that he was able to just do maybe an hour or half an hour, whatever he could manage. But he got his 2 A-levels, he got a distinction, and he's now attending university. Unfortunately, he can't attend every day, but he goes in on a daily basis. And he's just recently passed his first 2 exams. But the impact for him, my son will not engage. And he will not engage with professionals, he calls social workers, social journalists, because they dramatise everything. And what was unfortunate, the process we went through, the stage 3 advised them to do a course, the stage 2 advised them to do a course assessment, which is supposed to be a positive document for parents. The stuff that was in this document was massive. It was closed down without signing it off. It was another manager who said they'd only action the core assessment if the FII could be revisited. This was obviously a stage 2 investigation. But the impact for him is just, he has no life because of his conditions. He only goes to university. He spends the rest of his time resting in his room, and he will not engage. And the impact that it's had on our family is my daughter panics every time the doorbell goes off. She sees a lanyard, she thinks someone's coming. It's destroyed my marriage. My husband and I were together for 22 years, and the fight was just unbelievable of what we've had to go through and prove, and it just got too much. And it's just destroyed. It's destroyed me. You feel you're not believed, you feel you're judged, you feel you have to evidence everything. And I think what is so frustrating, part of the stage 2 and 3 was my son was awarded the direct payment for his care package, but unfortunately he got too ill, he wasn't able to go out and use them. I repeatedly asked for the criteria of what these could be used for, and it was denied. I was told there was no criteria. 2 years ago, I received invoices on a regular basis demanding that every single penny is paid back to Herefordshire Council. So I started another complaint. I've got to count the family complaints I've got against Herefordshire Council. And I was told that my claims to have had meetings with the director and the assistant director and the councillor, they have no record of. And unless I can provide records, then unfortunately they cannot look into my complaint. I know Dorothea is here now, and I will quite happily say I have recordings of those such meetings, I have witnesses, and I have statements of people that were in those meetings.
Well done, Laura.
So it's frustrating to be. It's like you're being personally attacked again. Yeah, it's like you're lying about your story. I know I sent photographs of my son in desperation when he was 14 years of age, and I took a photo of him, came out of the bathroom, and the image was just shocking. And my friends have seen him when he goes through these stages where he loses so much weight, he looks like he's come out of a concentration camp. And I was criticised. Questions need to be asked. Mother taking photographs of her son, but I was desperate in trying to highlight how thin he's become. So we're at the stage now. My son won't engage with anybody. He just wants to carry on and be able to get a degree. But the unfortunate thing is the conditions he has, it's going to impact him on for the rest of his life. And he should be able to access the service. And I think this FII affects every service you try to access, whether it be your GP. Everybody knows about it. It's on your notes, and they're reminded about it constantly. That's the problem. So, I think it's imperative if any of you are ever accused of this, please make a complaint. Document everything, and do not speak to them on the phone. Everything's via an email, so you have a paper trail that you can relate to. It's really important. So, that's really where I am. Ready?
Before Donna goes, This woman is incredible. She is her own forensic paperwork expert in her own right. I have had the privilege of seeing her front room, and it's like a detective. And she meticulously goes through every single bit around, and I really like Sarah Westerby. And that's all I'm going to say. There is a general theme that goes around, unfortunately, that parents are not empowered, that parents are not given a voice, that parents are not heard, that actually when parents read the care assessments, they are very damaging to the family, and particularly mother blaming, parent blaming, and it's almost like these social workers come in and they are looking for the most negative. We have so many beautiful parents, so many people that love. If you're fighting as hard as a number of these parents are, it's because you passionately care about your child. So that's what the Hereford Local Authority needs to particularly look at. Every single parent that is fighting for their child, they need to look at that. You need to look at that, because if they didn't care or they were abusive, they would have moved on. They would have moved on. And every parent has a right to have a voice, to be empowered, and for their case to be individually looked at. 50% of claims of the FII, and it comes in many various guises. Refrigerator mum. What is that? I don't know. A mum that can't parent. Well, how about some more parenting courses? Because before we get a diagnosis, we haven't done many, have we? You know,
Where's the manual? What's the ISBN number that is Social Services Perfect Parent?
You know,
where can I buy it?
And how about looking at helping and not putting barriers in the way? And how about, you know, some suspicious people might think that if you've got a very complex child, it could even be budget protecting. Now, I'm not saying it is, but I'm not saying it isn't either. But 50%, you know, these are statistics that Professor Luke Clements can back up on. 50% of neurodiverse parents, which I identify as neurodiverse, possibly ADHD. You would never guess, would you? On there, I identify that.
I joined the club.
So we do need to be treated under the Equality Act 210 with reasonable adjustment, because we are, the way we're set up, to be different. We will understand things differently. We will interpret things differently. Yeah, and we are also. Look at Richard Branson. I see being different is actually a gift. And what sort of a society are we when we're not inclusive, when we are discriminative? That's no society. And we all need to be supported and heard, and we wouldn't be fighting and making such a fuss if we didn't passionately love our children. And everybody's entitled to have their say and closure. And I do accept that it's not just Hereford, but I do say, having spoken to a lot of people, Hereford is particularly challenging to deal with. And there's an awful lot of lip service, and lip service is no good anymore because we're not getting that.
There needs to be more training on neurodiverse parents' children, and also rare illnesses.
100%. And that's the clustering justice.
It's more than that. Craig had an assessment for his disability as a disabled parent, his brain injury. They had a recommendation at the behest of Children's Services on him. During his PAMS assessment, did they follow one of those recommendations when they assessed him? No. They failed him as a suitable parent? Yes.
Yeah, because it's discriminatory, and we need to be open on this.
But when I said the reason why Bodie wouldn't come back in court is because he was settled and comfortable, and that's exactly what they said in the end. Because of where he was settled and comfortable.
It's difficult. I do know that we're going to get the panel up now, because I'm sure there's lots of questions, and Hannah's question has to be prioritised. She wants to ask it. Sarah,
So I want to commit to the
on
toilet,
there.
I'm sorry.
So we can have Luke and Sarah, and Donna and Mary. Yes, no, please do. If anybody wants to grab a quick drink, we can have a 5-minute.
5-minute recess?
Yes, 5 minutes. I do have Donna, yes, please.
Yeah.
And I'm going to lead the question. But first, we're going to let Anna ask Sarah the little question that she wished to ask.
So, from the question I asked earlier was about judicial review and what scope there would be for judicial review. So it'd probably be helpful for those in the room that don't know what judicial review is, just to give it a quick explanation if it's something you feel that we can do in this case. And also, it's really important from having heard what everyone else has been saying, particularly Mary. If Victoria had been under 4, the process that you would have gone through would have been completely different. It wouldn't have mattered whether you'd gone through that criminal court process and been acquitted. There is a 26-week timescale for any child that's of an adoptable age to be adopted. And at the moment, if we can link this again to the judicial review question, there is no legal recourse to families where children are adopted because of this 26-week statutory timescale if things come to light. The case law doesn't support particularly adoptions being overturned in the same way if you were convicted of a criminal offence, such as murder, and evidence then came to light that could acquit you. There is nothing to put those parents back in that position. Have their children back. And I think that's really, really important here, that also needs to be considered. Perhaps something that Luke can obviously consider with his research, because the issue is there is nothing for us. If your children had been younger, it could have been a completely different outcome.
It stopped at 5, isn't it? Doctrine.
Thank you. Thank you for that. There's 2 questions. I will start with the judicial review question. But judicial review can be used to challenge decisions by the state or an entity of the state if, for example, something is irrational. So, in this context, an illustration of that would be, is the guidance that you've discussed today of the Royal College of Paediatricians. There's been so much criticism of it. Can it still stand? Can it be challenged? And judicial review would be potentially a mechanism to do that. So it can be used in a lot of different contexts, and you need to think about it quite carefully. But that's just an illustration. I hope that helps explain what it is. The question about adoption is a really difficult one. I'm not a family lawyer. I don't know if you've got anything that you can add to that.
Not here, no. It's just I mean, the law is
Broken.
It is in adoption, yes, because of the way the UK is one of the very unusual countries. I mean, we used to do some transfer cases on this, and it's quite out of date. But this idea of closed adoption, the idea of adoption is actually quite unusual in many states.
Yeah,
this idea that you invite the state in and so I remember arguing cases in Hereford 30 years ago on these issues. Things have moved, but we are way behind much of the rest of the world that doesn't believe that you can do those sort of things. And that would take Parliament to change.
Absolutely, I completely agree.
Can I just point out the fact that in New Zealand, the whole of the country, there's only 20 adoptions that are adopted by children. In 1 year in Hereford, 21-22, there were 22 adoptions.
So nearly 2 a month, or 1 every 2 weeks.
Yeah. Most of the world does very well with that.
So I'm just going to move it on a bit, and there will be opportunity to have a little bit of mingle network on more personal situations. So I proposed the first question and gave you a little bit of thinking time. So addressing everybody, what the question was, I just remind you, is what one piece of advice would you individually give to what people are going through in your field of expertise on there? I don't mind. Donna? We'll take Donna.
Most definitely do subject access requests, because that's the information where you find out the discrepancies. In my case, you know, that's where I found a lot of the discrepancies, allegations. Big fat fibs, probably more like, but yes, there was lots of discrepancies which did back up. So just for example, when I got the subject access request notes for the professional that made the allegation and then compared it with the notes I had from social services, it just wasn't corresponding. So, and that's how the stage 2 investigation was so successful, because I was able to provide all this information to the evidence to the investigator. So yes, and what I said earlier, just sorry. They do try, and that happened to me. A lot of my information was completely blacked out, so I went back again and said this isn't correct. You need to do it again. The first time round, when I was doing the stage 2 and stage 3, lots of the information and notes they tried to withhold from me. I had a hell of a job. I was going into meetings and they were saying, oh, we deliver it to your house, and oh, we're actually deliver it to Plough Lane, so you get the information before you go into your meeting. I was fighting like hell to get these notes. And I think what is sad is, you know, if ever you do get one, please get a bottle of wine when you sit down and read them, because they're not nice reading. But yeah, that would be my advice. Definitely do your subject access requests.
And don't take the delay, because they delayed mine and now they won't release it because they're saying it's social education or something adopted. I no longer have rights to see that later. Yeah.
Did you have any circumstances? Because when I got freedom of access of information, there was names in there that we didn't know.
No, when you do your subject access request, all
which
of
is
us
a
have a
system
legal
that was
right.
copy and pasted. There's no doubt that first social worker would come to us, copy and pasted what they did.
Yeah.
Or it was the Google system, or whatever system it is. It shouldn't become my problem.
But if you get how I did it was I got the notes for every agency that was involved, so where they were corresponding with about you, I got those as well, and that's where you find.
Was this when it was live at the beginning?
No, I did them regularly.
No, exactly. This is what we're saying. We didn't. This is a problem. They said at the time you were trying to help people in your household that are illness, you're trying to support them. Yet then an external agent comes in that betrays to support you and attacks you, and then you don't know what's happening. What we think is, well, they're keeping this, what it is. And then when I got freedom of information, it's absolutely disgusting in the lives that they can do.
Yeah.
Absolutely. And to this point, when I put my hand up here, not one thing has been proven about me, and there's a reason. There's none of this ever.
But that's what we go back to personal opinion, not fact, and that's something I'd like to point out to Darryl Freeman. Is I'd really like staff, not just in social services, but all concerned that we document actual facts and we don't document personal opinion, because personal opinion is so dangerous, because it's like Chinese whispers. Another professional comes along and they're fed this information, and then it escalates and escalates, and before you know it, you have a visit from someone. This story is so blown out of proportion. It has to be factual evidence, not personal opinion. I mean, I had a social worker who was challenging diagnosis, said, I believe this young mother claims he has chronic fatigue syndrome. I don't claim he has a diagnosis. From a pediatrician.
It's like when we first came here, she saw me for 10 minutes at the pediatrician, and she made that, she wrote it down on a piece of paper and said that I made it. This is what I don't understand. So I had a really poorly child, and she didn't even look at his paperwork. She even wrote to his consultant and said, you don't need to see this child anymore. He's got
and that's the one thing I did pull up. No. There's no joined up thinking.
Yeah.
There's no joined up
you know, like
communication.
you have a child in care, or you have a CAP meeting, or why is there nothing? And then you have to fight for that. Whereas if you had that from early stages, early on, and you had that support.
Well, I remember the former director said to me in a meeting, Donna, I don't want you in 5 years from now having to keep telling the same story to professionals. That was in 2015, and here I am.
I was told last year that I need to forget about the past. Yet the past is written in the new report. Right, we're at that one.
So can I just put it on there, please?
Yeah, so following on from Donna, I would say evidence. Get your evidence. And don't just get your evidence, but make sure it's stored elsewhere.
back it up.
Yeah,
Back
good
it up
advice.
several times, wherever, so that nobody can get to it. And you want your evidence, you can take recordings, you can don't deal with people face to face.
Keep that evidence to yourself for a certain time, because that's what I've done. Because they keep one down the rabbit hole of they're lying and lying, and it's going to come out. Recordings, everything will come out.
Yes, yes.
We can buy your book, David.
Yes,
Yeah.
yes, that's right. So, yeah, that's it. Evidence just make
Evidence. Yeah, brilliant. There's one. Luke.
Get support. Don't think you're the only one in that situation. So support groups. Donna, there's support groups, Cerebra. Just get support and get good noise. But one of the really interesting things, because we're interested in problem solving across lots of areas and accessing things, one of the things that we've learned from Cerebra from our research is that the one thing a parent of a disabled child needs when they're confronting these multiple monsters that the state has created, not the individuals working in these bodies, is support, but it's emotional support. But the support that's been very obvious today is that support for individuals. And that emotional support can give you technical support and say this is a good word, this is a good advice service, but it's just that emotional support to realise you're not alone.
That's the island years ago. Without them, we would have gone under a long time.
Support.
Yeah. We're struggling without them, without this group. And the information today, because we know nothing. Ordinary people are quite often in this situation. And sadly, we don't know.
The Marches Family Network are absolutely amazing. I must connect the Marches Family Network. They're amazing.
Yes.
They're really good.
What's really great now is that these things are accessible. I mean, I think there needs to always be a public inquiry, so it's quite funny. During COVID, when none of these services were accessible for any of the families who had to then evidence changes without being able to even attempt or being able to access these services because they weren't running because of COVID.
Yes.
Any decision made about a child during COVID is automatically an issue because there wasn't any of the support available for you to be able to then go back and say, I've done everything. Yeah. And right now we're in a really good position.
I think we've got a good opportunity at the moment. I think this is definitely good there. There is a common bond as well. You've got a foot in the door now. Got to give Darryl respect. He's sat in the meeting. We can't change the past, but what we can do is change the future for people's lives. 6-7 years ago, I sat around the table with the police and I said, I tell you what, you've made a mistake now. I said, I am socially aware, and if you're treating me like this, you are treating other people that are in need, that could be depressed or whatever. Luckily, I had the strength. And, so that's what we've got to do. There is issues with the common bond. We can actually push forward for the change now. To get, we've got a foot in the door. We're getting support here. There's more people here. And let's keep the foot on the gas. Move forward with it.
We've got to all pull together and go forward as one, not.
Well, at the end of the day, whoever wants to out.
Can we just ask some more questions while we've got Sarah? Please,
Thank you. I'll just keep it brief because actually my first point was document things. And Donna, I thought you illustrated that very well when you said not over the phone but by email. So document, and then you stole my second point. And I would just say, in addition to the amazing organisations that everybody has just mentioned, the Challenging Behaviour Foundation too, and parental advocacy services, advocacy support for families, which I think can be really, really beneficial.
So I'm going to open up the questions that anybody here can ask anything, but please don't talk about your personal cases because it's more about open. Before you just want to acknowledge it, we do need to change culture as well with any social services involvement because people with social services do get ostracised and we're automatically seen as guilty. And we all have a duty to go out there and remind people that's not the case. Social services do need to offer service because that's what us taxpayers are actually much like an early years intervention, all sorts on it. But is there anybody that's got a burning question for the panel? Yes. Yes.
But quite important. Do we have statistics on allegations of FII against actually proven cases? Are there numbers yet for this?
Unfortunately, I don't think it's still been released. We're still waiting, aren't we? Yeah.
I think I will say, there is no statistics, reliable statistics, apart from, and even the statistics on which housing syndrome by proxy, which is really the only area there is from statistics. It's the best that there is, and it's very, very small indeed. I sat and listened to the council saying that the council saying that she believed that Hereford's FII rate was comparable with the rest of the country. Well, there is no comparable rate. It doesn't exist. And I work, we've been in touch with a number of media organisations, BBC, and some channel for private media organisations, trying to get this data and haven't been able to get this data. So it would be helpful if that was acknowledged.
Yeah, I've got a question. I'm just thinking about, you said that 353 people have been trained locally by the NHS to identify what is effectively a bony man, albeit real, which creates a very, very much a witch hunt culture. Would it not make more sense to train 35 people really, really thoroughly? Because it's such a rare thing, you could then pull in one expert that could.
Do we actually know what they are training? So is there, I don't know, is there so many points that you've got to, where are they trained, who are they trained by? If it's so minimal, who are they trained by?
Just Google it.
Google it.
You'll be pretty astonished
Okay.
at some of the training.
Just me from observing whatever service you try to use, there's a barrier. It's not a welcome, like the doctors, you can't get into the doctors. There's always, is this a way of forcing people not to sort of, is
It's a tactic.
a tactic to keep people, like, oh, they're playing again, they're not.
It'd be a good one, wouldn't it? It'd be a good one.
I've written a book recently, I should promote it.
You did say you were going to.
Yeah, it's very, very slim. It's smaller than. It's called Clustered Injustice. About the clusters that parents of disabled children have to deal with these different organisations and the toll it takes. But a lot of that is looking at the problems that organisations have, because actually we now have sort of top-down control systems within the NHS, within social services, within housing, where the frontline officers have no autonomy at all. They just have to follow orders.
And that's why
they have to tick this box. And so they develop a sort of learned helplessness, effectively, that if you've got a mortgage and you haven't got another job, you'll just stay there and you'll just do what you're told to do. Even though you came in with great ideas of helping people. And so we should realise that that sort of trauma exists within these organisations. That's why the NHS and social services are hemorrhaging stuff. Because they have so many.
I couldn't work in an organisation like that, the way they operate. I can work.
And it's that sort of idea of, it's neoliberal managerialism, actually, where you don't have, whereas when I started 40 years ago, social services were sort of quasi-anarchistic, basically, trying to help people. Now it's surveillance.
How dare you?
It's a sort of surveillance organisation which is terrified of a Victoria Finlay, and that's that. The one risk that everybody is concerned about is a large headline holiday. The real risks of traumatising 1.3 million parents
And I think as well.
So we've got to, just to finish, we've got to be sympathetic with these organisations, but
Yes,
we've got to force
yeah.
major structural change in the way they behave.
Yeah, so I was just going to pick up on that. You know, not sort of like bashing everyone. I mean, there's been some really good staff that have really wanted to help, but unfortunately, when they come on board, when they try to help you, they get shut down and then they leave, and we lose them from the services because these are really good people that want to make change. During my complaints, I actually had a member of staff. I obviously had to take on My Valley Trust and Together Trust, Herefordshire Council. Yeah, all of them in one go, and the complaints were running alongside each other. And the clinical commissioning group contacted me to say that they'd had a whistleblowing from a member of staff, obviously in my valley, about the appalling way in which I was being treated. So there are good staff out there that actually want to make a difference, but unfortunately, a lot of their whistleblowing concerns are not taken seriously. And the same happened with the council, another whistleblowing concern there. But they're going to have to listen to their staff. Their staff are trying to send a strong message.
Security consultancy at Hereford Hospital because they're going to be employing to security 24/7 because people getting engaged with the nurses are also not reacting well to them and they're creating a problem. Because I had to speak with the managers at the, they come to me, some security consultants, but basically, they're looking at employing to security officer at the A&E department. Because it's getting that.
Yeah, and that's half the battle with parents who are disabled with the social workers. The social worker doesn't know how to de-escalate that parent with either a physiological, neurodiverse issue. What they do actually aggravates and throws fuel on the fire. Then they report it as this unreasonable behaviour. It's suddenly now scared of domestic abuse or emotional harm to the child. And actually they can't factor in that because they've come into a strange environment to them, they're applying their well-earned knowledge, but it's not in a sterile environment that they've learnt that knowledge. It's in an environment that they don't control the variables on, so they don't know the individuals, the behaviours that are going to trigger certain things, particularly like if you've had PTSD as a consequence of anything else that's ever happened to you, you don't react in the same way.
Yes, the training is something that. So I'll propose another question for the panel. Could they recommend one thing each that would make a difference? Because the situation. So we could, Donna, what would make a difference?
I think better training for staff so they have a better understanding.
What sort of training?
I think especially on neurodiverse care, what I said before, children that have got obviously STEM difficulties and rare illnesses because it's so misunderstood. I think that's really, really important that we do that and so that we keep these staff, they want to stay and we don't have recruitment problems.
Well, I think that professionals should make sure that they have all of the information before they react. No good just reacting, they need to go to everything. So do their due diligence beforehand. Because they can do it without, it's possible to have got all the information about my daughter before they just react.
We avoided a lot of costs.
I was, yes.
To everybody and had emotional harm.
Yes.
The most interesting thing I was told last year, as you probably know, was the Oliver McGowan autism training going through. Is that the right name again? So the NHS is spending a fortune, really very large sums of money for training all frontline staff on autism awareness. Which is great. Training is great. We've got lots of trained social workers who come in, but then they behave differently to the way they were trained. And we were talking to, Anna and I were talking to the NHS who are doing this training program. Because we're trying to work out what you do to solve the problem. And it was just revelatory. And so the person I spoke to said, yeah, it's great. Professionals come along, they think it's great. They learn a lot from there, they go away. But if you really want to change the way things happen, change the forms, change the computer and that's Louise behind you, is involved with the Alliance and the wonderful Alliance in Gloucestershire. What happens is that the professionals, they don't get the evidence, they don't do this, but that's because they have to follow template forms. And every day, the professional will fill out one of these forms 3 or 4 times. And the question those forms ask, like, have you been in the bedroom, have you returned to the child, did you do this, did you do that? They reinforce the culture of the organisation. And the training they had 3 days ago just evaporates. And so you have to change the computer system because forms feed into computers. And you have to start by saying, if you're talking to a parent of children, you want to practically say, it must be incredibly challenging to bring up a child in this situation, rather than we have consent, to change the form, to change the questions. And so we thought that's great. If you want to change a template form, you have to change the computer. If you want to change the computer's basically turning up data. Do you know who programs the computers? Just changing a form, which I think is actually going to be crucial in saying to the profession, what is the hard evidence? 4 things down. Absolutely no hearsay. Just changing the form is incredibly difficult. But that would be revolutionary. And it would be true in the NHS, true everywhere. It's template forms.
Could I just come in on that point? That one of the things that I do now, because I've got hidden disabilities, I've got adult ADHD and borderline personality disorder, which was managed, and I advocate in Herefordshire Council absolutely detesting my name still smarter, and I'm currently now busy fighting another, I think I'm going for another unreasonable, vexatious, control me type of style. So what I do at the top of any letter I put now is I put, please remember I am classically disabled and any less capable treatment is unlawful. And then hopefully, and I would advise all parents and neurodiverse to always say to people, I am classically disabled. Please stop. I am going to record you because recording is allowed. It is lawful. People have social workers have the right to walk out if they don't want to be recorded. I accept that. But your door was open, so you've got an open door policy, so they can't say that you were hiding any evidence. And what the local authority did, because this week with the local ombudsman, I've got a reasonable adjustment in that where all my calls are video recorded. Because if I'm talking on the phone, people misinterpret everything I say because they can't see me. But when they see me, we're able to have some absolutely fantastic discussions. But there is I've got to make this clear to everybody here. There is a culture within Herefordshire Council. I mean, I'm currently pushing to get an investigator for the death of somebody recently on the streets because I work with homeless people, and what they do is people are going in with neurodiverse problems and they're not assessing them properly. So it's not just children's services. There is a culture embedded, a bullying, oppressive, abusive culture, and it starts with Paul Walker and works its way down. Every single one of you there is guilty of that abuse.
That's why we need
Yes, we're here as guests,
Well, this is what my doing is my colleague is doing. It's very interesting. Just to put it briefly, yeah.
Yes, so myself and Lucy were both parent carers, we've both been through jobs. So she set up the County Care Alliance in 2018 as a support group. We then started to get a lot of themes, first one of which was FII, so we started looking for support, which was amazing, as everybody knows. And we've got funding and we've grown an advocacy service and training and webinars and so on. And then we contributed to institutionalising parent care before we start those conversations with it. And as he said, it comes up all the time. We have both, our children have both transitioned into adulthood, and actually what they've put through in my daughter's room meant that she didn't want to engage, but she's 21 next month, she's severely disabled, she's very little life, and I said, look, you need somebody to help you have a life beyond that. So adult social care, and it is much more about what are your daily needs. You need to eat, you need to drink, you need to get this, you like to go out. What does all of that involve? What it doesn't do, which is again frustrating, is saying that okay, if that takes you so long, then you need so many hours of support. But it does at least look at your life. And we both go back to our children's services support, and also because we're supporting people who have all these things. And there's pages and pages and pages of history, but nothing about what you need. So it's like we just sat with you and gone through your whole life. And we talked about things, both of us, it's traumatic because we don't get believed, and then we get a diagnosis, and like you said, they're rare and they're complicated and they're long lasting.
No one believes them.
You've got to deal with all of that and talk to this person, and then they just go, right. Or they go, okay, well, I suppose you can have this problem. But then the next time we review you, which will be at some random date in the future, we're going to come out and go, oh, that box is too high. Yeah, I'm sorry, that doesn't cover a tenth of what we do in the
But you've also got them, like your son, who wouldn't engage anymore. You've got people who need this support, who are a former looked after child, who won't go to these services as adults as well. It's much bigger. There's so many things that all factor in and come together on this.
But what's so good, I mean, we're doing some research on this at the moment, and what the Imperial has done is to produce an assessment form for disabled children, not an assessment form for safeguarding, but an alternative that is just focuses on need, not the sort of stuff which you say is completely absent from children's services, but in adult social services, those assessments are full of what you need. And so you don't have this also this sort of killing field when you transit, because the children's services want the same. I mean, I should emphasise this is a national problem, it's not a Hereford problem, and it is the only way you can break the lockdown is for the Department for Education to change.
I think a lot of the problem is as well is obviously I get it from obviously all the different services that are involved. They have a protocol to follow, staff are trained in a particular way. But it would be really interesting if perhaps part of that training was taking and listening to what families have happened to them, their experiences, so that you can adapt things better. Because obviously, going back to the form, they have a generic form to fill out. These are real people. They don't all fit in the box. They don't all fit in those forms. And it may be beneficial if maybe on the top of that form that you have a slight history about that person. So it saves all this form filling that you go through, and that there are these different things that you can adapt to the form.
I think we've got time just for one more quick question so that we can just mingle with Sarah Westby's going to stay in this room, and I think there's a few people that want to chat it. Yeah, I know myself.
I think there's something in following that.
On there. Yeah, so
we've got a quote at 3 we need to go to as well.
So, no time for one last question?
No, sorry.
You got any questions? Yeah.
So one of the biggest things that came up when we started investigating FII is this business of when it is proving not to be true, is not the way to get it operating. And you've got families who went through all of that, and they will not take their child even to A&E supporting the FII.
You do have the right to have it removed, because I was offered it, but I'm glad I didn't, because otherwise I'd have removed all my own evidence. So I was given the opportunity to have the whole thing wiped off my records.
We were told because this is a profession.
Well, it's not fact-based.
It's a bit like the PMC that gets relied on by social care. They get the police national computer, which has all accusations that have been made against somebody, even when they're unfounded. It's there as a permanent mark on your record, whether it's been proven or not proven. PMC can't be removed until the person's 100 years old, or you get legal powers to do it.
We are pursuing this I've had some very, very high level legal advice on it, which I'm not quite sure I agree with. I think there are mechanisms to put it in a closed box that only certain people can unlock, so that mostly people don't see that information. There is maybe a very good argument, but there's no proportionality there. It's either there or it's not, and it's the first thing. If you look at the stuff I've given you, those sort of 7 pages of traumatic impacts, all of them are saying that when I hate going to doctors, the first thing he does is when they turn it on and red light, even though this is a discrete thing. So there must be a mechanism, if there is a need for it to remain, for it to be not generally accessible except with a twin key or something.
Our current GPs have not altered it. They put it so that these things are historical, so it doesn't come up on the record straight away. So they can do it. And,
yeah, just lastly, there are other organisations out there to support. We have got a Sunshine Support representative that came with us. So we're going to splinter off. We've got about 20 minutes on there. If you want to speak to Sarah Westerly, she's going to stand here. Luke is going to go out where the teas and coffees are. Grab Luke if you want to talk to him, and also Mary's going to go out there. If you need investigative information on ZARs, you've got Donna Conway. She is awesome on there. So networks is the whole point of this meeting as well. And lastly, thank you everybody for coming. Thank you.